Welcome, everyone. My name is Evan Bronson, webinar producer with CGLR. The webinar will begin at the top of the hour and will be recorded. Connect with the Campaign for Grade Level Reading on social media. On Facebook, like the page Campaign for GLR, and on Twitter, follow the account Reading by Third. Please use hashtag Learning Tuesdays and tag us to tweet anything you learned from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Again, the webinar will begin shortly, and it will be recorded and shared with you afterwards. I just have a few housekeeping tips I want to get started with. First, we'd love for you to introduce yourselves, so please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure to select panelists and attendees so that we can all know who is here. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any resources, slides, and bios shared during the conversation, will be shared in a follow-up email to all who registered. We'll be posting a brief on-screen evaluation during closing and highly encourage you to respond. This helps us with our commitment to continuous improvement. And now I just want to share some upcoming webinar opportunities. At 3 p.m. today, we'll have an increasingly urgent conversation on the impact of climate change on children and the ways we can promote a call to action for child advocates, philanthropists, businesses, and educators to address these challenges. On December 5th, we hope you'll join us for a conversation in which we discuss the ways that people are hearing messages about young people and engage with state and local leaders about their successful messaging and how they're ensuring that kids are a priority on the public agenda. We'll also be having a Crucible of Practice salon on the 12th, and we will have registration links and more information for all of these sessions in the chat box available for you now. And joining you now is Bonnie Howard, consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Well, good afternoon. My name is Bonnie Howard. I'm a senior fellow with the Campaign for Grade Level Reading, and I'd like to also welcome you to today's webinar, What Happens in One Generation or Doesn't Affects the Next, 2-Generation Strategies for Alleviating Poverty. We are delighted that you've chosen to spend time with us today. This will be our final session in our 2Gen series for the year. Some of you may recall that we began this discussion during July in Grade Level Reading Week. In that session, we gained an appreciation for what
Bonnie,
it means.
I think your camera's off. Do you want to just put that on really quick? Beautiful.
Sorry, I think I hit it. It's off and on. Is that good? There we go. Sorry. Some of you may recall that we started this conversation back in July during Grade Level Reading Week. And in that session, we gained an appreciation for what it means to be 2Gen. We explored 2Gen approaches that help low-income children and families. We heard from national experts to help us think about how to frame 2Gen, and local United Ways that were on the front line talked about the work they're doing on the ground. In September, we continued the conversation by going deeper into how United Ways are supporting high-quality education for children and helping parents skill up for better employment and economic security. And today, our plan is to focus on community-driven initiatives that help families access federal programs that provide income supports. We know that child poverty is a persistent issue with lifetime and intergenerational consequences. More than a quarter of the people living in poverty in the United States receive no help from food stamps and other nutrition programs, subsidized housing, welfare, other cash benefits, or child assistance. According to a report by the Treasury Inspector General for Tax Administration, about 5 million potentially eligible taxpayers do not claim the EITC credit each year, resulting in another $7 billion of unclaimed benefits annually. So expanding federal and state policies, helping parents and caregivers access these benefits would reduce child poverty and improve long-term outcomes for children. So with that as a brief setup for the conversation, let me introduce you to the folks who are going to be leading this conversation for us today. Next slide. There we go. Thank you. So first we have Samuel Gonzalez Cardona, has been president of the United Way of Puerto Rico since 2005. His arrival marked the beginning of an organizational transition process aimed at achieving greater community impact by advancing the common good to create opportunities for better life for all in Puerto Rico. Gonzalez has over 30 years of experience in business management, sales and marketing, and multinational companies. He served as president of the board of directors of the Diabetes Association of Puerto Rico, is a member of the board of the American Red Cross, presided over the Puerto Rico Volunteers State Commission, and served as director of the board of the Puerto Rico Chamber of Commerce. Iola Fortune is the she's not interim, but senior vice president of the impact team at United Way Worldwide. She provides oversight, strategic guidance, and support to team members managing key initiatives in education, economic mobility, and health. She leads United Way's efforts to support local United Ways to integrate equity into their impact work by developing frameworks, strategies, peer learning, and training opportunities, and developing resources and tools. She also leads United Way's efforts to collect and aggregate data from local United Ways to demonstrate collective impact across communities via the Global Results Framework. And next we have Josh Dixon. Josh currently serves as Vice President of Public Policy at United Way Worldwide. Before joining United Way, Josh was White House Senior Advisor for Public Engagement, where he led outreach for President Biden on healthcare, faith, and the American Rescue Plan implementation. Prior to joining the administration, Josh served as the National Faith Engagement Director, where he oversaw President Biden's religious voter mobilization program. And before the campaign, Josh worked in vice president roles with Teach for America and Points of Light, both AmeriCorps affiliates that are focused on national service. He also served as the director of the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Commerce, where he focused on economic mobility, job creation in economically disadvantaged communities. And Josh began his career as a teacher on the south side of Chicago, where he taught kindergarten. Pretty impressive. And then next we have Shayla Kohlheim. Dr. Shayla Guy Kohlheim is director of United Way of the Mid-South Driving the Dream Initiative, and where they're deeply committed to the Memphis community, and in particular promoting strategies that advance economic mobility for persons experiencing poverty. She brings to her role over 25 years of experience supporting programs and initiatives in the post-secondary education and career advancement sectors. She manages over 130 nonprofits in the Driving the Dream network. In her previous role as Director of Grant Development and Management at Southwest Tennessee Community College, Dr. Kohlheim was named a Tennessee Board of Regents Maxine Smith Fellow. And finally, I'm going to introduce you to our moderator who is going to guide us through this conversation today, and that's Marjorie Sims. Marjorie has over 20 years of experience in advancing the state of women and families at local, state, national, and international levels, as well as in expanding women's roles in leadership positions within philanthropy. Before joining Ascend in 2018, she served as program officer at the W.K. Kellogg Foundation, with a specific focus on family economic security programs. Marjorie held the positions of Chief Operating Officer, Interim President and Vice President of Programs and Operations at the Washington Area Women's Foundation, and served as Executive Director of the California Wellness Law Center, and as a policy analyst with the International Center for Research on Women. She is the co-founder of Women's Policy, Inc., which is an organization that emerged from the Congressional Caucus for Women's Issues to provide unbiased analysis and education briefings about federal legislation affecting women and families. And so I think I am leaving you all in some very capable hands. And so with that, to really get us started, I'm going to turn it over to Iola.
Great. Thanks, Bonnie. Hello, everyone. I think Bonnie promoted me. I'm the vice president for our impact team at United Way Worldwide. I want to say welcome to my United Way colleagues and to so many community and school partners that have joined us on the call today. I'm so pleased to be joining you again today for the last of our three-part webinar series, as Bonnie noted, on the ability of 2Gen strategies to holistically address the needs of families and to support their well-being. And my role is to provide some overall context setting to help frame up today's conversation. So as you may know, United Way has a global impact agenda, This reflects the work that United Ways do in communities every day in key areas that have the greatest impact on people's everyday lives to ensure that young people have access to a quality education, to increase the ability of individuals to obtain jobs that pay a living wage and make it possible to support oneself and one's family, and to ensure that everyone has access to healthcare and the ability to live in environments that enable us to live healthy lives. Our network of over 1,000 United Ways works cross-sector, based on deep relationships with the nonprofit community, with businesses and government. Many United Ways, including those on the call today, lead efforts to convene cross-sector to advance work that leads to equitable community change. And this includes 2-gen approaches, but also efforts like community schools, integrated service delivery, and Strive or Ready by 21 cradle to career efforts. We work across and within many sectors to address the specific issues that impact everyday lives based on the knowledge that these issues are fundamentally connected and that we need to work across many sectors to achieve lasting change that improves the trajectory for individuals and families. And that's why we've been a longstanding partner in the campaign for grade level reading in recognition of the power of national and local partnerships to leverage resources, to align efforts, and to create common goals and outcomes. If you go to the next slide. Based on data from United Way's Global Impact Practices Survey collected this year, this captures the work that United Ways are advancing in communities. The topmost areas United Ways are working in are childhood success and economic mobility, which are core components, as you know, of a 2-generation approach. In childhood success, United Ways work includes efforts to ensure that children get off to a good start in early childhood. This includes ensuring access to high quality early learning and early childhood programs, engaging families to ensure that they have the resources and information to support their child's early development and growth, increasing access to books to help foster literacy development, and partnering with community-based organizations and schools to support learning during the school day. In economic mobility, our strategies are focused on ensuring that families have access to financial services that enable stability, including free tax prep, tax credits, getting banked, and accessing affordable lines of credit. It also includes helping people get access to training, workforce development programs, and employment services to support their gainful employment and wage growth over time. In all of these efforts, United Ways are convening partners, engaging community members, making strategic investments, aligning and coordinating efforts, gathering data to understand progress and challenge, building awareness, and engaging in policy and advocacy efforts. Next slide. Half of all United Ways are engaged in some level of policy and advocacy work. This is based on the United Ways that reported data this year. Our network's greatest policy and advocacy efforts are focused in the same areas where we are doing the most work. So that's childhood success and economic mobility, which affirms how core these issues are to our work. Next slide. When we think about what that looks like, the most common policy activities undertaken by United Ways are engaging local officials to build awareness and support for key policies or influencing policy implementation, because we know that's critically important as well. Specific activities beyond that include partnering with other United Ways and state associations to create policy agendas to share with state level representatives, leading or supporting issue-focused coalitions and campaigns, or advocating for specific legislation at the state level. If we go to the next slide, specific examples of policy and advocacy efforts advanced in 2022 by local United Ways include expanding eligibility and the amount of tax credit available via the Earned Income Tax Credit and Child Tax Credit. You'll hear some examples of that later on in the webinar. Working on food access, primarily in terms of expanding eligibility for school breakfast and lunch programs, increasing access and eligibility for childcare, state-funded pre-K programs, and especially for ALICE families. That's an acronym for working poor, essentially, asset limited, income constrained employed. Addressing homelessness, ensuring eligibility for low-income families to access public assistance to which they're eligible. So things like SNAP and WIC and Medicaid and CHIP, and making sure that those programs, that there are not limitations imposed on those programs at the state level that thereby serve to limit access and curtail the number of families who can access those benefits. This work gives us the ability to advance equitable change at a systems level. Policy and advocacy is one of the best tools we have to ensure that we have the greatest impact and reach on the communities that we serve beyond the specific individual programs and initiatives that United Way's also support and invest in. And as you know, our policy infrastructure enables us to work at the local, state, and national levels in the U.S. And at this point, I'm pleased to transition to Josh Gibson, our Vice President for Policy and Advocacy at United Way Worldwide, to put our work in broader perspective and to identify help share the current federal policy landscape and opportunities for supporting 2Gen via policy. Josh, over to you.
Thank you so much, Iola. It's great to be with everyone today. I want to just give a huge thanks to the Campaign for Grade Level Reading and their leadership in such important work, and a huge shout out to Iola and her team for so much of what they're doing across the country, globally with United Ways to really bring so much of this impact at the community level. We can go to the next slide here. I am excited to share a little bit about some of our public policy work and the implications for 2Gen within that. Wanted to kind of start off with just a little bit of an overview of our team at United Way Worldwide, just for quick background, so you all have that. So the way that we're set up, I think as a lot of folks who are joining today know, United Way is a federated organization. So we have over 1,000 local United Ways all around the country, and then United Way Worldwide sort of works in concert with all of our local United Ways to harness the power of their voices and the impact of their work around the country and around the globe. And our team specifically leads our federal policy and advocacy efforts. So we are working closely with Congress, closely with the White House and the administration, and supporting the work of local United Ways at the local, state, and federal levels in their respective policy efforts. So we work very closely with the network to ensure that they are mobilized to be active participants in the policy landscape, and that their work can be elevated in a way that informs policy and provides more opportunities for them to do that work even better and to problem solve and address things that they're seeing in their communities in a collective and collaborative way. Our team has 4 key focus areas that I think are helpful for understanding policy in terms of how we approach it as a national federated nonprofit. So the first is congressional engagement, and this is largely in the advocacy arena. The second is executive branch engagement. And I think it's really important, and I want to just spell this out real quickly before I jump into the rest of my slides, that we very much see policy as both the legislative lawmaking, passing bills and having them signed, but it doesn't stop there. And that's really where the executive branch and administration focus comes in. And I think for me, from personal experience, seeing how much policy implementation matters and seeing that happens in so many ways through the executive branch, that's a huge priority for us. And I'm going to touch on that in a little bit later. But we are very focused on partnering and collaborating with the administration on implementing policy, on ensuring that a lot of these big laws and things like that are getting passed are executed in ways that really align with their intention and that provide as much opportunity as possible for as many people as possible in the communities we serve. The third key thing you can see down there in our focus areas is network support. I alluded to this. We work closely with United Ways around the country, with our state associations, and then with local United Ways to support their state policy and advocacy policy work. And then we do a lot of work at the coalition level. Working with organizations like the Campaign for Grade Level Reading and other organizations on big campaigns around things like the Supplemental Nutrition Assistance Program, the Child Tax Credit, and some other things that I'm going to get into in a few minutes. And a lot of that coalition work, is really focused on the fact that many of us in the nonprofit sector and in the advocacy space are working on some of the same issues. And so our voices collectively can be way more powerful than the sum of their individual parts. So we can go to the next slide here. Great. So just want to cover our policy priorities for the 118th Congress. That is the current Congress that was sworn in January of 2023. And just touch on these a little bit so you can have an idea of a little bit of the blueprint, and the way that I describe this as this really is kind of like our policy platform for United Way Worldwide. It very much encapsulates many of the broad level things that we stand for. It's not everything that we advocate for will not necessarily be included in here, but will be under one of these categories of things, because different things come up, opportunities come up in the advocacy space, opportunities come up in the policy implementation space. And as United Way, we focus on a whole litany of different issues. I think that's one of the things is we're not a single issue organization. We do so much work in communities. So many of you know that based on your work around the country, either for United Way or with United Way. I want to just touch a little bit on what we mean by these, like what's spelled out underneath each of these, because there are a lot of 2-gen implications, particularly in the education and childcare. Oh, can we go back to that slide? Let's go back to the previous slide, please. Thank you. Particularly in the education and childcare and in the economic mobility and workforce development space, there's a lot on the 2-gen front. So I'll start off with health and nutrition. So when we're talking about health and nutrition, which also has implications for 2-gen, we're talking about improving accessibility and affordability of healthcare coverage for all Americans. We're also talking about promoting mental health and addressing substance use disorders. We're talking about bolstering anti-hunger programs. And we're talking about creating safe and healthy communities. On the education and childcare front, this really kind of walks through birth to employment. So we're talking about access to high quality childcare for working families, a lot of 2-gen implications there. We're talking about ensuring families have high quality early childhood education options, Head Start, other things along those lines, ensuring kids have access to K-12 educational opportunities that set them up for long-term success, including supports for educators and educational institutions, and then supporting access to high-quality post-secondary education that can lead to gainful employment and increased professional mobility, and other career and technical options as well that can lead to those things. On the third piece here, the economic mobility and workforce development front, we're doing a lot of work on strengthening tax credits and tax assistance to support workers and families. We are supporting effective workforce development programs and opportunities. Iola touched on some of this work as well. And we have a real focus on increasing housing access and affordability. Interestingly, for United Way, last year, when we checked in with folks on some of the major issues that they were most interested in, housing bubbled up to the top as a top priority issue. It was also the thing that people called 211 for the most. And so this continues to be a strong area of focus. There are a lot more opportunities there right now at the state and local level than the federal level, but we're continuing to push on the federal level as well. And then the final piece here, which I'll just briefly touch on, is community resilience and sustainability. A lot of this is, looking at how do we support the infrastructure for a robust nonprofit sector? How do we support strategic investments in 211, which United Way supports nationally, which connects people to key federal, state, nonprofit, and frontline resources. Many 2-gen implications there, which I'll touch on in just a minute as well. How do we support resilient community infrastructure and equitable access to resources that promote environmental sustainability? And how do we strengthen disaster response funding and infrastructure with a focus on the hardest hit communities? So that's a run through our policy priorities, and you can see just layered throughout are a lot of things that have 2-gen implications. So we can go to our next slide here. Great, thank you. So I think, as we look at the current landscape in terms of challenges and opportunities when it comes to how we can engage in policy as nonprofit organizations, as community-based organizations. I think that there are some things that it's really important to be aware of when it comes to challenges, and there are some big opportunities. And so much of public policy work is knowing what to prioritize and what not to prioritize. Prioritization is so much the name of the game. And so the landscape and the environment really matter in significant ways. So right now, when we talk about challenges, this is going to come as a surprise probably to no one, but we have a divided Congress, which we've seen play out. We have seen this result in delays in funding agreements. We have seen this in twice now coming up to potential government shutdowns that have been averted. Once in the 11th hour, once just a few days before that was about to occur. We've seen very few bills passing, some major bills that are up for reauthorization that are supposed to be passed every 5 years. We have not seen consensus on these, like the Farm Bill and a number of these other major reauthorizations. So right now, this divided Congress is providing a lot of roadblocks. It's providing roadblocks in terms of organizations that have applied for earmarks, a lot of congressional spending and things like that. New things happening is very tough to push through right now, given these dynamics. Some members of Congress are also categorically opposed to virtually any new spending, which makes it hard to find new funding sources. And this is a policy position that has been taken in the House in particular, where we see just an outright upfront opposition to anything that is going to add any money, no matter what that's for, no matter what the ROI is. We have encountered that in some of our advocacy, and we've seen that in a number of ways. So that's another just tough piece when it comes to some of these things that we're pushing for, because we have to find offsets, or even sometimes there's not really an openness to offsets as well. And then the administration at times, when it comes to working with the White House, working with the federal agencies, and working on bill implementation, sometimes the administration is delayed in implementing legislation due to capacity constraints. You have a number of bills that were passed over the last couple of years. The American Rescue Plan, which was an almost $2 trillion bill. You had the bipartisan infrastructure law, which is a massive bill, close to $1 trillion. And then you had the Inflation Reduction Act, which is $800 billion, I believe, something like that. And across these bills, it has brought in a lot of work that needs to be done in a short amount of time, and agencies are figuring out how to do it. And we've seen RFP deadlines pushed back and delayed. We've seen timelines for selecting grantees and folks for government contracts delayed at certain times, and so there's a lot of activity that needs to be undertaken, and sometimes there are delays. So that continues to be a challenge in certain ways, and we're seeing that play out, and that's to be expected. We understand that, but these are some of the dynamics that are currently at play when it comes to these different things. When it comes to opportunities, we do see some bipartisan agreement on notable 2-gen policy areas, on some of our tax policy areas. Like we see some interest in the child tax credit. We see some interest in earned income tax credit. We see some interest in some education and workforce things. And so even though it can feel like Congress is completely at loggerheads, we do know that there is interest in working on some of these issues in a bipartisan way, and we know that a lot can potentially be done even amidst divided Congress. We also know that Congress is going to change, and every 2 years we will see a new Congress come in, and that could mean the same parties have control. It could mean different parties have control, but regardless, you're going to have a lot of new members. And we've already seen a lot of folks on the House side in particular announce their retirements from Congress this year, or announce that they're not running for re-election. And so that does provide opportunity to build new relationships, to seek out different conversations with folks who are coming in to committees that have a lot of clout and that are overseeing our areas of interest and things like that. So we're keeping an eye on that. We also know that even if right now isn't a time where a lot of bills are being passed, it's a really good time to educate congressional offices on the work that we do, and really build up strong rapport with them so that when the conditions are right for bills to get passed, we've already built some of those relationships, and they already see the work that we're doing. They already value it, and we have a listening ear to some of the things that we're raising up to them. We also know that the bills passed between 2021 and 2022 that I mentioned earlier, they continue to provide partnership and funding opportunities, even though some of those are slowed down a little bit. There are things like the Affordable Connectivity Program that are out there for connecting people to no-cost, high-speed broadband. There are things out there on the healthcare front, with some of the subsidies being continued through the Inflation Reduction Act. There are a number of things out there on the climate front that are going to be coming down in terms of tax credits, where there's going to be a focus on harder hit communities and disproportionately impacted communities. So we know that these bills are going to be implemented for a litany of for many years, especially the infrastructure law and the IRA, and they'll also provide employment opportunities through the different projects that are going to be funded through that too. So we're keeping a close eye on that and think that that could be a really great place to lean in as an organization, and for any organizations that are joining today. And then finally, the administration has shown an eagerness to work with us on the United Way side, which we can really speak to, but with the nonprofit sector and community partners on the whole. And I know, looking at the American Rescue Plan as an example, I was in the administration at the time and working on that team that was implementing the American Rescue Plan, and we leaned on United Ways, Catholic Charities, a lot of other partner organizations, Feeding America and others, to get the word out. And to let people know about these resources, to let people know about free tax preparation services, to let people know about the different things that they could be taking advantage of, emergency rental assistance, LIHEAP to assist with utilities and things like that. So we know that this administration has an openness and eagerness to work with the community, and that really is an opportunity on the implementation side. So that's a little bit of the rundown, kind of how we're thinking about the challenges and opportunities. I'm going to run through in a couple quick minutes are what we see really as advocacy opportunities and then policy implementation opportunities. We'll start off on the advocacy front. One of the things that we want to make sure everyone's aware of is the Two-Generation Economic Empowerment Act. This is a bill that is specifically focused on two-gen opportunity and empowerment. It was introduced most recently in the Senate with bipartisan co-sponsors in the 117th Congress, so last Congress. It was introduced by Senator Martin Heinrich from New Mexico and Senator Susan Collins from Maine. It gives states, local governments, and tribes more flexibility to develop programs that meet their needs. It really focuses on some key things, on streamlining some things, and make sure that opportunity is increased with a lot of state and local impact based on the challenges that are faced by each locality. A couple provisions of an earlier iteration of this have been signed into law, including, as you can see here, a request for the Government Accountability Office to issue a report that explores the potential for two-generation pilots, collab areas, and federal funding opportunities. And second, a new program administered by Treasury to implement social impact partnerships to improve the effectiveness of social services. So these are all good starts. The study is a good start. The pilots are a good start, and we want to see more. And the Two-Generation Economic Empowerment Act is something to keep an eye on and something to include in your advocacy conversations with members on the Hill and member offices, which we encourage all of you to have. A few other things that we see as having potential here. One is there's talk right now about a possible new tax package. We will see where that goes over the coming 2 to 3 months. The child tax credit and earned income tax credit are on the table. So expansion for those is a huge priority for us at United Way. But in general, for the child tax credit in particular, was one of the most effective anti-poverty tools that we've seen when it was a part of the American Rescue Plan in decades. And so we want that to be signed into law, to be expanded, and to be continued, because it was discontinued to the levels of the American Rescue Plan when that expired at the end of 2022. Voluntary income tax assistance funding is another huge 2Gen thing, largely because it helps people access free tax prep services, which lowers the barrier to receiving tax credits like the CTC and the EITC. So we are pushing for Congress to fund this at $45 million for the next year. And we know that so many United Ways and other partners are involved in VITA and play a very big role in ensuring communities receive those services. The Farm Bill and Supplemental Nutrition Program is really important. It is coming up for reauthorization again. It was pushed back. It was supposed to be reauthorized this year, got pushed back to next year. But ensuring that SNAP levels stay where they were agreed upon in the debt ceiling deal is really important, because 80% of the Farm Bill is anti-hunger programs, and this really does govern what SNAP looks like. The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. Funding for WIC is really important. We're continuing to focus and push on that and make sure that is not on the chopping block for cuts. Full service community schools funding, we saw $75 million last year. We think that can be a lot more. It's a great investment. 114 United Ways are involved in community schools, and so we're looking to increase opportunity there for our local organizations. Workforce development, we know that WIOA is up for reauthorization soon. We know that Opportunity Youth could be included in some packages, and we're trying to push there as much as we can. Support for 211 is a major advocacy area of opportunity. Right now, there are 3 major federal numbers that are designated by the FCC. There's 911 for emergencies, 988 for mental health crises, and 211 for social and human services. United Way supports 211 nationally. We're close with 988. Of those 3, 211 is the only number to not receive any national federal funding ever. Last year alone, between 988 and 911, they received over $600 million. We love 988 and 911, and we think that they should absolutely receive federal support. We also think 211 should get federal support. During COVID, 31 governors designated 211 as their official emergency response line for COVID. No federal dollars from Congress were going into that, and so we know that there is an even bigger role for 211 to play. We're going to continue to focus on that, and then just equitable policy solutions for other 2Gen related issues, like childcare, like healthcare, like housing, and things along those lines. So this is all on the advocacy front. These are all things that we think that there is a big opportunity to push Congress to take action on, even if that comes in the next Congress. Right now is a really good time to start building that momentum for the 119th Congress. And then finally, I'll close with this on policy implementation opportunities. So the last slide was advocacy. This is implementation. So this is getting into the work. This is not just saying this is important, Congress should pass this. This is saying we want to partner with the administration on making this happen in our communities. So promoting VITA and My Free Taxes is really huge for the reasons I shared a little bit earlier. Helping to enroll people in programs like the Affordable Connectivity Program for no-cost broadband, SNAP and summer EBT, healthcare and Medicaid, all of that helps out significantly. And there are a number of opportunities to get funding from different federal agencies to help with that too, once you've done a little bit of it. So good opportunities there on the implementation front, and a lot of 2Gen implications for these, I think, especially for the Affordable Connectivity Program, and how many barriers are broken down by folks having access to no-cost broadband and not having to go and sit in a McDonald's parking lot, for example. Promoting plans like the SAVE plan for student loan repayment. Right now, I know a lot of parents in particular, it can free up resources for them and their kids and their families, and help out with opportunity moving forward. We are working with HUD on a pilot around the Choice Voucher Program, so participating in that and helping be a part of that work. That research is another way on the housing front. Joining a full service community schools coalition, which we can share more about post-call, or partnering with the administration to implement their increasing access to high quality care and supporting caregivers executive order, which is really focused on the entire caregiver industry. And they rolled out this executive order somewhat recently, and they're looking for nonprofits to partner with. So I know that we we've got some questions in the chat that I'm going to get to, and then I'm going to turn it over to my colleagues. But I know there's a lot of information, but just big takeaways here are lots of opportunity to advocate on 2Gen policy issues, both when it comes to legislation, but also to be involved in policy implementation. And I think that there's so much there that can be missed, that really is a great space to lean into for local nonprofits. So one question is, how are parents' voices heard in the policy priorities? It's a great question. We did a significant listening tour to get a lot of input into our policy priorities. We worked for 6 months to hear from folks on that, and provided United Ways around the country, community partners, and others. So many parents' voices are reflected there, but then also a lot of folks from different corners of the country, from different parts of the United Way network, and from outside the United network as well. So we ran a really comprehensive effort to get buy-in, and really actually saw a lot of common themes there when we ran that process. And we're going to run that process again for the 119th Congress. The next question is, what is the advice for companies who are building tools and products that have a 2Gen approach to solve the early childhood reading crisis? Does United Way offer opportunities and support for piloting such products with these families? I see Iola is typing a response in that, and I'm going to defer to her team on that a little bit. I think in a lot of ways, that is a little bit more of a programmatic question than a policy question. The next question is, do you have a read on the likelihood of getting a new appropriation for the Affordable Connectivity Program, since the funding is likely to run out by April 2024, and other pressure points we can leverage at the community level so this valuable program to get low-income households connected continues? That's from Larry. Larry, that's a great question. There is a lot of focus on re-upping those appropriations for the Affordable Connectivity Program. We are working in coalition with a number of others, including Comcast, and other different partners on the community side and on the utility side, to push for more ACP funding. I know that the number one thing that we can do is push on, is talk to members about why this is so important for communities. That is the number one thing that we can do, is for you to reach out to your member's office if you haven't already, and make sure to let them know the impact it's having and why more funding is needed. I think that telling those stories is huge, and we know that Congress needs to continue to hear about that a lot, to continue funding the ACP, especially for folks who have members that are on the Energy and Commerce Committee on the House side. That's really huge. So great question, and encourage everyone to keep doing that. We're gonna continue to do that. Loan repayment, Shelly, I see a question there about the SAVE program. I will drop in the chat links to the different resources that I mentioned, including the SAVE program. So I'll drop that in. Christina asked about opportunities for social impact bonds and outcomes-based financing human services projects. So there have been a lot of the social impact bond work has taken place at the local level. And I know that there have been, I don't have as much of a line of sight into it on the federal side, but Christine, if you email me about that, I can have my team look into it for sure. And then Jerika, I will drop a link in the chat to that executive order as well, on the supporting increasing access to high quality care and supporting caregivers. So you can take a look at that and explore ways to be involved. Okay. With that, I am going to turn it over to my colleagues, Samuel and Shayla, from our great local United Way in Puerto Rico. Samuel, over to you.
Thank you, Josh. Excellent presentation. I'm going to focus my presentation on how a group of 30 volunteers from my local board impacted a community of 3.3 million people, improving the opportunity for over 250,000 children in Puerto Rico. Just to give you some statistic, in Puerto Rico, 57% of the children live below the poverty level. So this represents over 326,000 boys and girls, and of this, over 75% live in a household headed by a woman with a median income of $8,400 per year. So you can imagine that was our motivation to visit Capitol Hill and advocate for the implementation of the tax credit in Puerto Rico. Next. So this initiative for us was like throwing a rock to the moon. We were asking for a tax credit, and we do not pay income tax, so federal income tax. So you can imagine who was asking for a tax credit, and we do not pay federal taxes. But let me be clear: we pay more taxes than my brothers and sisters in the 50 states. Next. Just to give you a background, Puerto Rico is a territory of the U.S. since 1898. We was sold by Spain, and in 1917, the Congress granted us the U.S. citizenship. We do not vote for president. We do not have a form of representation in Senate and only a commissioner resident that do not have the vote. So next. Before we visit the Capitol Hill, we train our board volunteers in advocacy, first in Puerto Rico and then in the United Way Worldwide headquarters. And at the end of the day, we visited 17 Congress members. And for our surprise, the next year, the Congress approved the extension of the tax credit to the Puerto Rico community. Next. The challenge then was to convince, families that pay over 37% in local income tax to fill a U.S. Income tax form. So we make a collaboration effort with other organizations, and we began conversation with the IRS to allow Puerto Ricans to fill a special income tax that they approve, and they name 1040 PR just for Puerto Rico, just to apply for the child tax credits. Thanks to the donation of Mackenzie Scott, we implemented an educational campaign to convince the families to fill the federal tax form, and these are some of the examples of the campaign that we did to convince the public, the families, to fill that form. Next. With the support of then the ball was in our court, with the support of various affiliated organizations. We established 6 beta centers, mainly in shopping centers, in order to help families to fill the 1040 PR. Next. These are a photo of a press conference that we did, to let the people know that we have those beta centers all around Puerto Rico. The next slide is a 15-minute TV ads. So next.
Padre, madre o encargado, si tienes un menor dependiente de 17 años o menos, hay miles de dólares para tu familia. Infórmate. Llama hoy al Centro de Información y Referido 211, United Way de Puerto Rico.
It is in Spanish, but you can feel, the energy and what we was looking for. At the end, 123 additional families applied to the child tax credit, with an estimate direct financial impact of over $500 million in Puerto Rico. So So this is the presentation that I wanted to share with you of how 10 members, volunteers of our board, improve the opportunity of life for over 250,000 children in Puerto Rico. Thank you.
Samuel, that was an exceptional presentation and such a great example of the power of will and organization to improve the lives of many. I, again, am Shayla, and I have the privilege of presenting today on Driving the Dream. I'm a proud employee of United Way of the Mid-South, situated here in Memphis, Tennessee. If you have heard anything about Memphis on the news, despite some of the crime that we hear about, it is a lovely city, rich in community and history, music and food, and citizens that are dedicated to improving the lives of other Shelby County residents. Next slide, please. To give you a brief background on United Way and Driving the Dream, United Way of the Mid-South turned 100 years old this year. And so what that means for us is that we've had many, many years with partnering with organizations to understand some of their pain points and also to understand some of their customers or clients or participants' pain points as well. When Dr. Robinson came on as the president and CEO, he, through his diverse background, was able to articulate how operating in silos or simply paying for one type of direct service was not moving the needle in many of the lives of individuals. So around 2016, there was a large convening where a mission and a vision was put in place for Driving the Dream, in addition to some assessment tools so that we could actually measure any type of project progress that was being made. Around 2017, these things were formalized, and by 2018, it was operationalized in contracts to certain partner groups. Next slide, please. What the previous slide did not speak to was what was happening in the environment around us. Internally, the conversations were had, within the community conversations were had, but at a state level between 2019 and 2021, it became apparent that there was a large amount of funding that had not been expensed or allocated to community groups for the purposes that they intended. So if you combine the relationships that were being developed and formalized with the environmental factors of policy allocation and implementation of resources, you find an environment that was rich for a Driving the Dream to flourish. So what is Driving the Dream? Driving the Dream is a coordinated network of effective community-based services and supports to help individuals and families advance from where they are to where they dream to be. It's significant that I use pronouns in describing they, as Driving the Dream runs on self-reports, and the assessment is based on an individual's perception, feeling, and thoughts about the progress that's being made. Thank you. So the goal of Driving the Dream is equitable access. The objective, or how we achieve this goal is through the alignment and integration of local services. The reason why this is significant is often summed up in sort of cliche terms. Your network often determines your net worth. In Memphis, the poverty rate is 22.6, the child poverty rate is 32.7. And in many of these areas, access to resources, access to vital supports that create foundational opportunities for growth are limited by who you know. Driving the Dream for many people is a bridge or a gap cover for resources. The results of interacting within Driving the Dream are people are hopeful, resilient, and self-sufficient. And for everything that I'm stating to you as a result, it is measured. Next slide, please. Our approach, as with most of the things spoken about on this call today, come from a 2Gen framework. The screen before you tells the general sense of what 2Gen represents for us, but what it doesn't speak to is what happens behind the scenes or the principles that guide the work. The principles speak to having a measure and an account for the outcomes that we seek. It requires that we engage and listen to the voices of the families that we serve. It requires us to review in an effort to ensure equity, not only for the individuals that we serve, but also for the agencies that we represent and partner with. It requires that we foster innovation and evidence together, not one or the other, but how do you blend those two worlds in order to secure funding that actually helps individuals. It also requires that we align and link systems and funding streams, which I previously spoke to. Next slide, please. The way that we do that is through our delivery approach. Our delivery approach is organized into the frameworks that Josh previously spoke to. So the 4 key components are education, economic supports, assets, health and well-being, and social capital. For us, education ranges the gamut from your P16 systems to upskilling individuals, and for some, GED or graduate studies. Economic supports and assets relate to financial management components, the entire spectrum of what that means for individuals. In addition to the nonprofit agencies that we partner with, we also work with neighborhood groups to make sure that they have access to resources and supports. For health and well-being, we're speaking to food, we're speaking to supports ranging from helping folks get to doctors' offices. What does it mean for you to be healthy? How do we support your well-being? And for social capital, it's internally referred to as the secret sauce. What are the human points of connection that bring joy, support, and net worth work to your network? Next slide, please. An easier way for me to describe it is through illustration. A simple wheel, a hub and spoke wheel, if you would allow. Whereas I started the conversation with United Way of the Mid-South being a backbone, implying that and evidencing that we provide leadership, strategy, and data and support to the 130 agencies we serve, we partner with individuals. When we refer to partnerships, there are 3 primary partnerships that we have. The first is care coordination, or those hubs that are satellite sites inside of the community that provide direct support to to individuals. What that means is a person that is experiencing multiple concerns within their life, or from a technical standpoint, is assessed as someone who is in crisis, they are provided with a care coordinator, a counselor, a social worker to help them move from where they are to stable or to self-sufficient. Care coordination timeframe typically is between 6 to 9 months. There's some individuals that have extenuating circumstances that stay on a bit longer. Our referral network partner is the agency that signs on to us that specializes in one thing. We never ask for anyone to go beyond their scope of work, but we ask for them to be a part of a system that allows them to influence and increase awareness of other agencies that are doing good work outside of their scope of work. The referral network partnership is connected through a database where individuals can tell their story one time, and their information, with their permission, is provided to all the other agencies in the network. So if I go into the food bank and I'm requesting services for food, and someone hears that I also have housing instability, our network will allow them to receive support from that one stop. Lastly are our outreach partners, and similar to Secret Sauce, is points of connection. So churches, other agencies, community centers that don't necessarily have programming or direct service supports. They just see a large number of individuals that could benefit from some of the services that we have. They partner with us to increase awareness of our program offerings, and also our partners. Next slide, please. In the background of all of that, we also maintain relationships, and it sometimes hosts 2Gen learning communities where best practices are discussed. Human nature is not linear, and if any person has ever lived, you understand that algorithms don't necessarily always work out. So what are the best practices that are in the field that are addressing some concerns as they arise? Secondly is our systems advisory team, and these are a group of leaders situated in Shelby County that focus on some of the problems that we do. Conversations include crime, Crime is one of the things that unfortunately gets us a lot of attention. So what as a collective are we doing to address it? One of our most recent topics related to the area of housing and how there is not a causation, but there's a correlation between housing instability and crimes against property. So what resources, what interventions do we currently have that we could use to improve that or increase awareness to some of the first responders that we have locally? Next slide, please. As a result of everything that I have briefly presented to you, all of the nuts and bolts of Driving the Dream, there's been impact. So families that we work with, 48% reported that they had more stable employment. 66% reported that they had higher income. 53% reported better financial management. One of the responses that we had to COVID, and the last bullet point on my screen, relates to the call center. What we were made aware of, and I guess that's the nicest way to put it, is that the pandemic highlighted inequities in services, and inequities in services specific to accessibility to services. So as a result of that, United Way of the Mid-South stood up a call center. And since April of 2020, there have been over 12,000 calls to that call center. The call center also manages our online referrals so that individuals can do self-referrals, I apologize. What is also unique about United Way and our commitment to accessibility and equity is that now we have started to put kiosks into community centers and libraries around Shelby County to ensure that citizens that have spotty internet or are not on a direct line for public transportation or simply have lost utilities, they still have access to some type of support and resources. In order to fulfill the kiosk initiative, we partnered with the local government here. Next slide, please. At the beginning of the presentation, I spoke to the work that was done from 2016 and how that work coupled with environmental factors, negative environmental factors. There was about a $700 million TANF fund that was not allocated in the state of Tennessee. So that created for us an opportunity window for us to pitch this evidence-based, because we did get it evaluated through the local university, practice to the state. As a result of that application, the state awarded United Way of the Mid-South $18.2 million to expand a previously $3 million project. Through our expansion efforts, our hubs or our care coordination goes from 3 satellite sites to 12. We're able to expand the referral network, not only increasing the number of agencies, but incentivizing agencies to better engage within our database so that we have better data. We provide emergency gap funding from individuals. Through our braided funding source, we were initially providing about $500 for emergencies. Through this funding opportunity, we're able to provide families that are in care coordination up to $2,200 annually to support their emergency needs. That's huge for us. Next, we have the opportunity to increase capacity building for some of the agencies that partner with us. Again, ensuring that there's a standard of care for any participant that chooses to partner with us. Lastly, improving data sharing across agencies. Josh alluded to this in his awareness and advocacy. Data for most of us tells a story. Qualitative and quantitative data has been critical in telling the story. Not only is it critical to help clients progress, but the data supports and provides an opportunity for policy to turn into payments for agencies like ours. That concludes my presentation for United Way of the Mid-South.
Thank you, Shayla. What a wonderful presentation. And I'd like to welcome back Sam and Josh so that we can start our Q&A portion of the conversation. Hi, everybody. I'm Marjorie Sims. I'm Managing Director at Ascend at the Aspen Institute, as Bonnie shared. and I'm going to moderate a conversation. And again, thank you, Josh, Sam, and Shayla for a rich conversation. There are a couple of questions in the Q&A that I'd like to resolve or answer before we go into our questions. And the first one, and I think these couple really are for you, Shayla, and one is from Richard Taylor, and that is, how is Driving the Dream addressing the benefits cliff, particularly for those families at risk of losing Medicaid?
Thank you. Thank you. It's a great question, and one that we consistently think through. The care coordinators are trained to speak directly to any participant that they work with on assessing the pros and cons, or simply stated, the opportunity costs with increasing or upscaling. Additionally, we partner and use the 211 app to make sure that individuals are aware of the services that are available to them. Lastly, we do try to use some of the unrestricted to bridge a gap whenever there is a one-time or immediate need associated with that benefits cliff. But the root of that answer to you is a conversation. It does not happen without people helping people navigate the space.
Yeah, wonderful. Thank you so much for that. And I'm also going to ask Josh and Sam if there's anything that you would like to add, because we know that the benefits cliff across the country is a huge issue for families. So wondering, Josh, for you at the federal level, if you're doing any advocacy around that, or Sam in Puerto Rico. Josh, you want to go first?
Yeah, absolutely. It's definitely something that we're in conversation with congressional offices about. It's really on the federal level, it comes down to Congress. And that's it at the end of the day. And given some of the challenges that we have right now, where Congress can't pass a budget, it's a tough situation. It really is, to be very honest about it. And so we're doing what we can. I think the more that people hear from organizations like yours, the more that they hear from their constituents, the more that they take it seriously. And so it's the number one thing that we can encourage everyone to do, is to talk to your congressional offices about this, because that's what they care about the most. Their number one thing is what's happening in my community, how can I represent them well. We're continuing to do advocacy at the federal level on this, and it's going to take some long-term solves across a multitude of programs with the benefits cliff, but it's something that we have our eyes on, and we're actively working with coalition partners on it as well.
Wonderful. Thank you. Sam, anything to add here that you're doing in Puerto Rico that might be informational for our participants?
You know that you can have faith on your volunteers, and don't think that the hill is too high. You know, in our case, was almost an impossible challenge. You know, but you have to do it. You have to represent your community, and do your best effort to solve, you know, the problem that is affecting your community.
Absolutely. Thank you so much. And this next question also is for you, Shayla, around how do churches connect with United Way to provide support, the provision of services?
Thank you for the question. First, I have to acknowledge that we are below the Bible Belt, so there are lots of churches here, right? So churches can partner with us in two ways. One is as a tier 2 or referral network partner if they have a 501c3 that tends to stand alone from the church to provide community services. The second is an outreach partner. Specifically, they become a marketing or awareness outreach partner for Driving the Dream. And in that role, they can receive support or a stipend to spread the word about Driving the Dream.
Wonderful, wonderful. Josh, anything to add here? I know you have rich expertise in working in the faith community. Anything to add?
Yeah, I think that you know, Shayla covered it really well. In my experience, when it comes to working with religious organizations, you know, the work itself is about shared priorities. And ultimately, at the end of the day, when there are shared priorities, there's so much opportunity to come together, regardless of what's bringing people to those shared priorities, and for a lot of faith traditions, it's part of their belief system, it's part of their theology, but the work you do with them doesn't have to be about that. It can be really about those shared priorities. And I think ultimately at the end of the day, as long as you are doing work that is conscientious of where there may be any sort of legal strictures when it comes to some of these things, which there's some good IRS guidance out about that. But in general, if you're serving the community, there's nothing against coming together to serve the community. When you bring other things in, you have to be a little bit careful with that. But really, if you're coming together to run a food bank or to do something else along those lines, or to do a rides program or to do a caregiver support program or something like that, as long as it's focused on the work itself, oftentimes our religious communities are the places, especially in today's day and age, where you have the greatest sense of community and where you have the greatest gathering points for people in the community. I think that so much, right now, really, with people being online for so many things, oftentimes it is religious institutions and schools that bring people from the community together as much or more than anything else. So when it comes to organizing and when it comes to engaging with folks at the local level, I think from my experience, that's where I found there to be a tremendous amount of potential. Yeah.
Wonderful. Thank you so much for that.
Especially
Sam?
during crisis, the faith-based communities organization help a lot. During COVID, we activate, the churches, and we was able to distribute in-kind products and other things to the community using the faith-based organizations.
Wonderful. Thank you, Sam. Thank you so much.
And oftentimes too, just to build on that really quickly, during disasters, during emergencies as well, a lot of times faith-based organizations step up, and in addition to being oftentimes a trusted community voice, they often have physical space as well, that's conveniently located and things like that too. So I found in my experience before coming into this job, I still work a lot with faith-based organizations, just in different ways on the advocacy side, but in doing community-based work, faith-based organizations can, when approached the right way and worked with in the right ways, as Shayla and Samuel are doing, can be phenomenal partners.
Wonderful, wonderful. And Ayola, would you like to add to this part of the conversation? That would be wonderful.
Yes, I just thank you for that, Marjorie. I just wanted to quickly add that we found that during COVID, it was also quite an effective way for United Ways to reach communities that you may not be familiar with or have, access to. And so, because especially in the early days of COVID, it was so inequitably experienced in terms of low income and Black and Brown communities of color, faith-based organizations were critical in getting out PPE, in getting out food and educational resources when schools had to close their doors. And so they can be critical partners, especially to United Ways that may not have those relationships as strong in those communities as well. So I just wanted to echo what many of my colleagues are already sharing with an example.
I appreciate that. Really important to have those relationships and connections to be able to serve families. Okay, Shayla, there are still a number of questions for you in the Q&A, so let me see if I can combine these two, because they're really focused on technology. What technologies do you, your coordination hub partners, referral partners, and outreach partners use? And then also, what is the system in place for the project? And this is the database system that you're using or was implemented as part of it. And what data sharing agreements you have in place for such a large huddle. So, Shayla, you want to take that?
I'm going to do my best. So the first part on the database that we use is a system called Caseworthy. Caseworthy allows us, United Way is responsible for the licenses that we give to any partners that are onboarded. As part of the partner onboarding, we do have a formalized data sharing agreement that must be signed. The data sharing agreement not only explains who has use, it also requires us to understand how the
Wonderful.
information is going to be used, and it establishes the permissions to use data,
Wonderful.
segregated
Yeah.
data.
Is
United
that
Way,
accessible broadly, or is that proprietary? Did you all build that, or can you share a little bit more about?
Caseworthy, we did not build. You are able to modify
It? Okay, so it's
in
something
order
that's
to
out
meet
on the
your needs,
market
but
that we
it's on the market, certainly.
Okay, wonderful.
And as part of our SOC 2 compliance, again, because we are dealing with some client level information, we have a sincere data sharing agreement that speaks very well to the terms of use and the process if you want to use data.
Wonderful.
So we maintain tight controls over that. And then the last part, which is more the technical part, United Way provides shoulders the cost associated with having licenses in the community.
Great.
And we also are responsible for training individuals for using it.
Okay, wonderful, wonderful. Thank you for that. And so Kirsten and Melanie, I hope that answered your questions there. If not, please ask more detailed if needed. Okay, and then we have another couple of questions here from Jerica. Love the presentation, Shayla, and the information about driving the dream. And what are some of the ways driving the dream incentivizes agencies that partner with you? What type of data sharing, and we kind of talked about this, is in place already? Do you have a 211 system in place, and do they support with care coordination and case management of driving the dream cases? Or are the driving the dream case management and care coordination efforts handled by community partners? And then finally, can you share some of your evidence-based resources that you use to build driving the dream strategies? So those are all great questions, very detailed.
Perfect. Thank you for those questions.
Absolutely. Thank you.
The first one is rooted in incentives. And the best way to answer that is to break them into two buckets. One would be those incentives that are monetized, and the others are not. So for those that don't require funding, spreading the word on social media. So starting in January, we will highlight our partner agencies, the great work that they're doing, and some of the ways that individuals can connect with them through our social media. The second is incentivizing, making sure that they have space at the table. Again, if you are rooted in equity, that means that you believe in individualized consideration. And the only way to get that is to hear the voice of those individuals that are doing the work. The next is making sure the next incentive that doesn't require money is making sure that the decisions that we make or the uses of internal United Way funds meet the needs of those individuals that are doing the work. On the other side of that, for the way that we can pay people, we pay our hubs to be satellite sites for driving the dream. So that is a fee-for-service contract. And with the referral network partners, we also pay for some of the services that they provide. It's categorized, it's detailed, and I'm quite happy to have a meeting with you or invite you to another chat about that to go into greater detail. But the referral network partners are also eligible to receive payment based on 4 categories. Those categories being completion of intake, closed loop referrals, service enrollment, and then them also evidencing that their service moved individuals from crisis to safe or stable.
Wonderful.
The second question was related to 211. Is that right?
That was the third question. So go ahead and answer the 211. Yeah.
Okay. So 211, United Way of the Mid-South has its own 1844 number. So we have the call center number that I spoke to in the presentation. And for the clients that do self-referrals through the call center, we support them internally through our own care coordination. We have a wonderful team of individuals comprised of social workers, some counselors, quite diverse background of individuals that help manage the referrals that come in. I hope that answers that question. I think the number 2 that I overlooked was the database. And I believe
data sharing, which I think you already somewhat answered in the earlier question. And the
All right.
last one is how can you share some of the evidence-based resources that you use to build the Driving the Dream?
Yes, one of the practical tools that we have is Transitions to Success. If anyone is familiar with TTS, we do use TTS, we do use HEARTH. We have a battery of assessments that are already vetted in the community that we have combined in a way to provide our evidence-based approach. And then what we did was we employed the services of the University of Memphis to come in and help us to be able to tell the good news through a researched way, in a researched way.
Wonderful, wonderful. Thank you for that. And so I
Anytime.
think we've addressed all of the questions that were in the Q&A. Someone can let me know if I missed any. But how about we welcome Josh and Samuel back for a couple of questions that I would like to pose to the group. And first, Sheila, I love the way that you started your presentation by talking about the assets of your community, right? And really lifting those up. And I know the importance of, how do you get started in this work? So the first question for all of you is, how did you get started doing your two-generation approach, your policy advocacy? What was your starting point as an impetus for it? And were there any specific things that happened in your communities or Josh, within, the organization that really shaped this work for you? Sam, would you like to go first?
Yes, of course. As you saw in my presentation, the financial challenges that the Puerto Rican families are suffering, really pushed us, to go to Capitol Hill and advocate for the child tax credit. And you have to also remember that we suffer one of our most disastrous Hurricane Maria just 2 years early that worsened the economic situation. So we was not motivated because of the challenges that our community was facing after Maria, and we saw an opportunity to try to bring the child tax credit to Puerto Rico, and that was that is how we ignite that initiative, and of course the support of United Way Worldwide was incredible. They receive us, they help us, in the coordination. Visiting 17 Congress members in one day is not easy, and you cannot do it alone from Puerto Rico without, representation in the Congress. So our network, our United Way Worldwide office help us a lot, and that is how we was motivated to go to Capitol Hill and advocate for the child tax credit.
Wonderful. Thank you. Thank you for that. Really important to understand the community context and some of the barriers and opportunities there. So thank you for that, Sam. And Josh, I'm curious, obviously United Way Worldwide has been doing policy advocacy for decades. But, I guess the question for you would be, how do you consider, each Congress? Do you also work at the state level? And how do your priorities shape up? You mentioned engaging parents and families in the work. So could you share a little bit more about that?
Yeah, absolutely. That's a great question, Marjorie. So when it comes to the policy priorities that we put together for each Congress, so we do this every 2 years, and this has been going for a while now, since well before I started at United Way. We really try to ensure that our policy priorities reflect the work of the United Way network and what's happening on the ground, reflect the priorities and things that United Ways are looking to see happen at the federal level, are informed by local United Ways. So that's where we do an exhaustive number of listening sessions this past round for the, we took 6 months to put these together when I started in my role in January last year, about a year ago. We made sure to listen to folks. We made sure to listen to community partners. We made sure to listen to our board, to different advisory councils that we have, to our Council of States, different leadership bodies. And then we surveyed folks in partnership with Iola and her team across the board in terms of just kind of getting every local United Way a chance to weigh in and share what their priorities were. And so for us, we really wanted to make sure that it was something where it was shaped and driven and reflective of what's happening, but also what people want to see happen and align with our overall vision. And then we really use that agenda to guide our work in a lot of ways. As I mentioned, and as Shayla touched on, and as Iola touched on, United Way, we're not a one issue organization, and we're not just not a one issue organization. We're not even like a one issue organization and then tangential issues. It's like we have a lot of issues that local United Ways work on across the board, and I guarantee that, Shayla is working on a lot of things that overlap with what Samuel's working on, and a lot of things that are different based on the challenges of their local community. And this is one of those most amazing things about United Ways, and why I worked with United Ways all the time before I worked at United Way. And it's because they know the community. And they work with everyone. They work with all the sectors, and they do a tremendous job of understanding what's happening there. And so I think that going back to like the root of this question, Marjorie, of like where to start with this work is, I think for me personally, where I saw where I've learned probably some of the most formative lessons was when I was a teacher on the south side of Chicago and got involved as a volunteer with a community organizing group that did organizing around issues impacting young adults in Chicago, and the kind of main issues that were at the fore for the community, and getting a chance to work with people from different organizations and backgrounds, and just figuring out what to work on together. Even if it's like raising your hand for a coalition project that someone else is working on, or putting an idea out there and saying, hey, I see this challenge in our community. Would you all work on this with us? Just like putting it out there, figuring out something to collaborate on will help you learn so much about yourself and help you learn so much about the work of other people and your community. And then you can keep doing that and refining it and figuring out how to do it better over time. And I think that that's what helped out the most from the time that I was working at the community level in Chicago to the time that I was working in the administration for the president, because you're still doing the same thing. You're figuring out, what can we work on together? Where do we agree? Where can we find common ground? Even if we're really different in a lot of other ways, how can we find those points of agreement and lean in there to make a positive impact for our community?
Wonderful. Thank you so much, Josh. I think, sharing that example and that belief and strategy and the way in which United Ways work in community and at the federal level, national level is so important, because you have to build those relationships and get that input to drive, the work strategically, but also, as you said, it builds buy-in, right? People are invested in, the success of the approaches. So Shayla, I know we don't have a whole lot of time left, but I wanted to give you an opportunity to weigh in here about how the work, specifically driving the dream, got started. And then also I want to round out with this last question that's in the chat, and that is, the attendee noted that they enjoyed the Driving the Dream presentation. As we know, there are many organizations who now offer various types of family coaching to assist families with goal attainment to get families from poverty to self-sufficiency. Is this a new model for a welfare to work program? I have a lot to say about that, but I will let Shayla take that on, and if there's time, I will add in. But Shayla, first, quickly, how did you get started, and then respond to this question.
Thank you so much. Thank you for those very, very good questions. In a nutshell, I'm going to say that I completely agree with everything that Josh and Samuel have already said.
Wonderful.
The right questions, the right relationships, and an understanding of the environment. So the challenges and the opportunities that are before us in the environment, coupled with the other two, give us an opportunity to identify funding opportunities or to identify those critical partners. Dr. Robinson, who is the CEO here, had background experience as a pastor, commissioner, physician, and educator. And he's worked in all four of those. So he really was situated at an intersection and had the relationships already to create something like the Driving the Dream. So for someone that is new to the role or new in this space, but interested in seeking something similar, the questions that I would present are: who's leading the change that the community desires? What are the community connectors that are uniquely positioned at the intersection of policy influence and poverty symptoms?
Yep. Yep.
Okay.
Yeah.
And then the welfare to work program question. I dare not say that this is a new model for the welfare to work program. I dare say that the Driving the Dream is influenced by community voice. It is situated because of what the community, this community in particular, has asked for. I come from a place where people are tired, where people have been burdened by symptoms of poverty for generations that go beyond my comprehension. Situated in the Delta, most of the economy here is either agriculture or a transition into a warehouse economy, which again is rooted in the same system of moving parts or paying a small amount of wages to a select group of people for the purposes of a select good, right? So I don't think this is a welfare to work program because the human voice is centered here.
Yeah, absolutely. And I'll just, double click on that to say that two generation approaches and driving the dream is one of an example of many very rich programs in communities. They start with the voices of families, the voices and recommendations of families, not with, bureaucrats and systems designing programs. So thank you, Sam, Josh, Shayla, for wonderful presentations, great conversation. I will turn it over to Bonnie now to close us out, and just much appreciation to the Campaign for Grade Level Reading and United Way Worldwide for such a rich partnership. So thank you.
Great. And we are down to the wire here. And I think Marjorie has done a great job of thank yous. I want to remind everybody about the upcoming Learning Tuesday webinars. Please stay tuned. We will keep them coming, and we hope that you continue to join us in those. I just want to sort of end with, I think that we all know that disrupting intergenerational poverty helps ensure more hopeful futures for children of low-income families. And this afternoon, we've heard quite a bit about the work that you're doing that really can make a difference to support families so that you can help them make ends meet, so they can more easily afford the cost of raising their children and save for the children's future. So as we all get ready to prepare for the holidays and also start to think about tax season, the end of the year, so we're pulling all our receipts together and trying to figure out how we do our taxes, I think it's really been a great opportunity to talk about how we can make a difference. So allow me to thank Marjorie for her stealth leadership here in moderating this session, to Iola, Josh, Sam, and Shayla for their time and expertise. And most important, thanks to all of you for joining us today. So everybody have a great one. If I don't see you again, have great holidays. Thanks so much for joining us.